Heart attacks are often depicted as dramatic, chest-clutching events that send people to the floor. However, not all heart attacks announce themselves so vividly. Many are silent, meaning their symptoms are subtle, easy to miss, or misunderstood. Despite their quiet nature, these silent heart attacks can be just as life-threatening as the more obvious ones. Understanding the signs and taking action can save lives. A silent heart attack occurs when blood flow to a part of the heart is blocked, damaging the heart muscle. The silent label simply means the symptoms may not feel severe or typical. Unfortunately, this can lead to delayed diagnosis and treatment, increasing the risk of complications like heart failure, arrhythmias, or even another, more severe heart attack. Here are 6 common signs of a silent heart attack that are frequently overlooked. By recognizing these subtle symptoms, you can take steps to protect yourself and your loved ones. 1. Unexplained fatigue. One of the most overlooked signs of a silent heart attack is sudden and unusual fatigue. Many people dismiss this as a symptom of stress, overwork, or lack of sleep. However, fatigue related to a silent heart attack is often extreme and persistent, not relieved by rest or sleep. This fatigue can occur because your heart is struggling to pump blood efficiently due to blocked arteries. Your body diverts energy away from non-essential functions to keep vital organs functioning, leaving you feeling drained. If you notice persistent fatigue without an obvious cause, especially if it's accompanied by other unusual symptoms, it's worth consulting a doctor. 2. Mild chest discomfort. Silent heart attacks often don't produce the intense chest pain typically associated with a heart attack. Instead, you might experience mild discomfort, tightness, or pressure in your chest. This discomfort can be fleeting and may not seem severe enough to warrant concern. People often mistake it for indigestion, heartburn, or muscle strain. However, any sensation of chest discomfort that's new or unusual should be taken seriously. Chest symptoms might come and go, but they shouldn't be ignored. If they persist or are accompanied by other signs on this list, it's time to seek medical advice. 3. Shortness of breath. Breathing difficulties can be a key indicator of a heart problem. If you find yourself getting out of breath during activities that previously felt easy, or if you struggle to catch your breath while at rest, it could be a sign of a silent heart attack. Shortness of breath occurs because your heart isn't able to pump blood effectively, leading to fluid buildup in your lungs. This symptom is often dismissed as a sign of aging, lack of fitness, or a respiratory issue, but it could signal something far more serious. 4. Pain in other parts of the body. Heart attack pain doesn't always occur in the chest. For many people, the discomfort radiates to other areas of the body, such as arms, especially the left arm, shoulders, neck, jaw, back. This pain can feel like an ache, tightness, or pressure, and it might come and go. It's easy to attribute it to physical strain, poor posture, or a pinched nerve, but when combined with other symptoms, it could indicate a silent heart attack. 5. Nausea, indigestion, or stomach pain. Many people don't associate stomach issues with heart problems, but nausea, indigestion, or even stomach pain can be signs of a silent heart attack. These symptoms are particularly common in women. It's easy to write off these symptoms as a gastrointestinal issue, but they could indicate that your heart is in distress. If these symptoms are unusual for you, don't ignore them, especially if they're accompanied by other signs like fatigue or chest discomfort. 6. Dizziness or lightheadedness. Feeling dizzy or lightheaded, especially when combined with other symptoms, is another common but often ignored sign of a silent heart attack. This happens because your heart isn't pumping blood effectively, leading to reduced blood flow to the brain. Some people might even faint or feel like they're about to. While occasional dizziness can have many causes, persistent or severe episodes should prompt immediate medical attention. Who is most at risk? Certain factors increase the likelihood of experiencing a silent heart attack. These include age. Risk increases as you get older. Gender. Women are more likely than men to experience subtle or atypical symptoms. Diabetes. High blood sugar can damage nerves, making it harder to feel pain and recognize heart attack symptoms. High blood pressure and cholesterol. These conditions strain the heart and contribute to artery blockages. Smoking damages blood vessels and raises the risk of heart attacks. If you fall into one or more of these categories, it's crucial to pay close attention to your body and recognize when something feels off. What to do if you notice these signs? If you suspect you might be having a silent heart attack, don't wait for the symptoms to worsen. Take these steps. 1. Call emergency services. Don't drive yourself to the hospital. Emergency responders can begin treatment immediately. 2. Chew aspirin. If recommended by a doctor, chewing an aspirin can help thin your blood and reduce the severity of the attack. 3. Stay calm. Stress increases your heart rate and can worsen symptoms. Focus on steady breathing while you wait for help. Prevention tips. Preventing a silent heart attack is possible through lifestyle changes and regular medical care. Stay active. Regular exercise strengthens your heart. Eat heart-healthy foods. Focus on fruits, vegetables, lean proteins, and whole grains. Monitor blood pressure and cholesterol. Keep these levels in check with regular testing. Quit smoking. It's one of the most effective ways to reduce heart attack risk. Manage stress. Chronic stress can strain your heart over time. Get regular checkups. See your doctor for routine exams, especially if you have risk factors. Conclusion. A silent heart attack is just as dangerous as a typical one, but its subtle symptoms make it harder to recognize. By understanding these 6 signs, unexplained fatigue, mild chest discomfort, shortness of breath, pain in other areas, stomach issues, and dizziness, you can be proactive about seeking medical attention and potentially saving your life. Heart health is vital, and paying attention to these often ignored symptoms is a critical step in protecting yourself and your loved ones. Recognize the signs, take action, and prioritize your well-being.